So you're curious as to how and why I landed here at Memorial. Well, I feel that a lot of that comes from some of the finer qualities in life that my wife taught me as I grew up to be. She tells people oftentimes, I have 7 children and I'm the 7th baby. But, we've been wonderfully able to raise our family in Niagara County. We feel safe. The people are friendly. You can afford to have 6 children in Niagara County. So it's always been a personal mission to continue my work in Niagara County. I have a little bit of a swollen head and a little bit of pride, so I want to be able to offer the best environment to provide health care to my patients. And with no disrespect to the other hospitals in Niagara County, I found that the Memorial provided me with the opportunity to practice my form of medicine and to bring patients here because of the care that they get. I like to at least believe I'm providing the best care possible for my patients. And here not only do I believe that they get magnificent spine care, because there are other spine surgeons here that I believe are spectacular as well, but I found that the nursing, I found that the food, believe it or not, I judge hospital by its food. And I'm in a very Italian area, so it's very beneficial. But, the administration obviously is way above board. We're the only unaffiliated hospital that still can practice medicine as it wants because financially, Joe or Mr. Ruffalo keeps the hospital in the black. They're willing to bend over backwards to provide all of the technology available, and some of it these days can be expensive and detrimental to a hospital. But I think he's got a vision of where the place can be, and they've allowed me the free rein to try to bring in new technologies. We have a stem cell program, which is juvenile, but we're hoping for sure that it's going to grow. I'm preparing next Monday to go to New York to orient myself with technologies, newer technologies in endoscopic spine surgery. We're talking about the potential to have your disc repaired or your nerve decompressed in an ambulatory procedure that's closed with a Band-Aid. We're using the most modern techniques in both motion sparing and spinal stabilization, and we have an outstanding anesthesia group that's willing to meet the challenge of those. Specific anesthetics are required to do appropriate spine surgery, and our group, bar none, I think, is as good or better than any other anesthesia group that I've worked with in Western New York. And don't get me wrong, I'm not demeaning any other group, but again, practicing medicine is not playing a solo, it's being part of an orchestra, and all of the pieces have to fit together right to provide the best standard of health care. We have a great emergency room in an area that does tend to see high visits to the emergency room. We have interventional cardiology. In a hospital with the number of beds like this, to support an interventional cardiology program, it's just not heard of. It's not done anywhere else. And if you take a look at the dossier of the hospital, year after year, award after award, the hospital is named as a center of excellence. We have 2 different cancer groups, a cancer center forming here now as in conjunction with Roswell Park. I am a graduate of Roswell Park, and I can tell you that they will accept no lack of quality. They would not place their doctors here unless they were sure that they could create a standard identical to that at Roswell Park for cancer services. So for me, while I live in Lockport, and I have no disrespect for Eastern Niagara Lockport, this was where I felt more comfortable being able to do what I do and be as progressive as I can be in a very safe and convenient manner.